This is the video on parasitic infections. There is a variety of parasites that can invade the brain. A parasite is an organism that lives off a host and causes injury of the host in the process. The brain has a blood-brain barrier to protect it from invaders, but when this breaks down, the brain has little else to defend itself. Since the recent hurricanes of 2020 in the south, water has been infected with Naegleria fowleri, a shape-shifting amoeboflagellate, sounds kinda sci-fi, that causes a primary amoebic meningoencephalitis. Naegleria tends to be found in hot tubs, where it can easily live if the hot tub is not cleaned appropriately, as it likes warm, shallow water. The amoeba will crawl up the nose of the individual in the hot tub and enter the brain through the cribriform plate. Typically, within a week, the symptoms will occur of headache, fever, and nausea. This will quickly advance to confusion, seizures, loss of balance, and hallucinations. Death occurs within 2 weeks if not treated, and even if treated with the antifungal medication called amphotericin B, the fatality rate is 95%. Another parasite is a tapeworm called Taenia solium. The tapeworm lives in both humans and pigs. The pigs develop an immune reaction to the worm and typically do not show any symptoms. It is most easily transmitted to humans from undercooked pork. The tapeworm, per se, does not live in the brain, but the eggs and larvae can move into the brain and muscles of the host from the bloodstream and form cysts. The cyst is 1 centimeter or 2 in diameter and contains the scolex of the tapeworm. They form in about 2 months after ingestion. The symptoms of cysticercosis depends on where the cysts form and how many are formed. There are headaches and seizures typically, but also blindness and motor problems. Some cases may show no symptoms at all. Treatment may include medications and possible surgery for removal. Toxoplasmosis is a condition caused by Toxoplasma gondii, a single-celled obligate intracellular parasite. It can affect a number of different animals, including cats. In adults, the infection does not cause much in the way of symptoms, as the immune system tends to attack and kill the organism. In the tachyzoite form, T. gondii can rapidly replicate. Then it will form a bradyzoite cyst to hide from the immune system. While in the cyst form, the immune system does not attack it, but it can do nothing more than hide there. The cyst can hide in the tissues of the host for the rest of the host's lifespan. If the bradyzoite converts back into the tachyzoite, the immune system rapidly kills it. It is thought that 11% of the population of the US is infected. This does present with some problems as the parasite can cross the placenta into the newborn. Also, if the host becomes immunocompromised, then the cyst can convert and rapidly proliferate in the brain. Again, the symptoms will depend on where in the brain the parasite is residing. There are some treatments for acute toxoplasmosis with antibiotic combinations. A parasite named Trypanosoma brucei causes sleeping sickness. The parasite lives in the salivary glands of the tsetse fly and are injected into the host through a bite. The trypomastigos into the bloodstream and the lymphatics, where they can enter the nervous system. The area of the bite might show a reaction comparable to an infection with the formation of a canker. Depending on the subspecies of the parasite, it can live dormant for months or years in the host. Once the parasite is activated, death is the inevitable result, unless antiparasitic treatment is initiated. The disease is called sleeping sickness, not because the person sleeps all the time, but because the sleep-wake cycle is disturbed, and the person sleeps all day and is up all night. So, on that note, this is the end of the video on parasitic infections of the brain.